In the last video, we saw the origin and the structure of coronavirus. For those who haven't seen it, we have put the link to the video in the description box. Please do try to watch that video before this one. In this video, we shall learn about the modes of transmission, pathogenesis, and symptoms of COVID-19. The virus can spread to a healthy person via droplet transmission, airborne transmission, or fecal-oral route. Droplet transmission occurs through respiratory droplets of diameter greater than 5 to 10 micrometers. It can be through direct contact or through indirect contact. Spread via direct contact occurs when a person is in close contact, that is within about 1 meter with someone who has respiratory symptoms. Indirect spread may occur through fomites such as door handles or keys or any objects or surface that has been contaminated with the respiratory droplets. Airborne transmission occurs via droplet nuclei or aerosols with diameter less than 5 micrometers. They can remain in air for longer periods and can transmit to others over distances greater than 1 meter. Airborne transmission of COVID-19 is possible in specific circumstances such as aerosol generating procedures like endotracheal intubation, tracheostomy, and cardiopulmonary resuscitation. There is some evidence that COVID-19 infection may lead to intestinal infection and be present in the fecal matter. However, spread through fecal-oral route is not yet confirmed. The virus enters the body via the portals of entry, which may be nasal, oral, or ocular. The virus initially colonizes the upper respiratory tract, then it reaches the alveoli of the lungs. In the alveoli of lungs, ACE2 receptors are present in the type 2 pneumocytes and the pulmonary capillary endothelium. The transmembrane protease serine 2 present in the host cell is involved in the proteolysis of the spike protein. The S1 subunit of the spike protein then binds to the ACE2 receptors and endocytosis of the virus occurs. It then releases the positive sense genomic RNA, which is similar to mRNA and is translated to the viral RNA polymerase. Replication of this positive sense genomic RNA produces negative sense genomic RNA. The negative sense RNA cannot be translated into protein directly. Instead, it must first be transcribed into a positive sense RNA that can act as an mRNA, which on replication will produce the subgenomic positive sense RNA. This on translation produces the viral proteins in the endoplasmic reticulum, and the assembly of the viral genome and protein occurs in the Golgi vesicle, producing the virion, which is released out of the host cell through exocytosis, resulting in destruction of the host cell and the release of the new virus. There is destruction of the pneumocytes present in the alveoli. The type 1 pneumocyte is involved in the diffusion of gases in the alveoli, and destruction to it leads to hypoxemia. The type 2 pneumocytes is involved in the production and secretion of surfactant, which provides the elastic properties of lungs, and destruction to it causes difficulty in breathing. Destruction of the capillary endothelium results in fluid leakage into the interstitial space, causing interstitial edema. Pulmonary edema occurs when this fluid enters the alveoli. Alveolar macrophages present in the lungs forms activated T cells, releasing interleukins 2, 6, 8 and TNF-alpha, which results in cytokine storm known as cytokine tsunami. The infiltration of inflammatory cells into the alveoli causes acute respiratory distress syndrome. Increase in interleukin 1 and prostaglandins leads to fever. Massive release of cytokines may result in systemic inflammatory response syndrome, which may cause endothelial injury, finally resulting in multi-organ failure. The major causes of death include systemic inflammatory response syndrome, multi-organ failure, acute respiratory distress syndrome, and stroke. The time period between the exposure to the virus and appearance of symptom onset is called incubation period. The mean incubation period of SARS-CoV-2 is about 4 to 6 days. The disease can occur completely asymptomatic. If symptomatic, the symptoms usually appear within 5 to 6 days and may take up to 14 days. The most common symptoms include fever, dry cough, tiredness. Ache, pain, sore throat, nasal congestion, headache, GI symptoms, loss of taste or smell, conjunctivitis, rash on skin or discoloration of fingers or toes are some of the lesser common symptoms. People above 60 years of age and individuals with coronary artery disease, diabetes, hypertension, obesity or pulmonary disease and other immunocompromised states are categorized as risk groups. The largest cohort reported in China with more than 44,000 people with COVID-19 showed that the illness severity can range from mild to critical. The mild to moderate cases shows mild symptoms up to mild pneumonia, and 81% of the cases are found to fall under this category. The severe cases shows dyspnea, hypoxia with greater than 50% of the lung involvement on imaging, and 14% of the cases are found to fall under the severe category. In critical cases, respiratory failure, shock or multi-organ system dysfunction is observed, and 5% of the cases are found to fall under critical category. Difficulty in breathing or shortness of breath, chest pain or pressure, loss of speech or movement, bluish lips or face are to be seen as emergency warning signs, and medical care should be sought immediately.